started. Good morning. My name's Nancy. I'm the RN that's going to be doing your assessment today. Can you
Good
tell me?
morning,
Good morning. Your name and date of birth, please?
Jeff. June 29th, 1967.
Okay, very good. I'm going to be looking at your head and your eyes and your nose, your mouth, your neck. I'm going to be checking your lymph nodes, see if there's any abnormalities. Do you have any history of problems with your eyes or your nose?
No.
Lymph system,
No.
anything now?
No.
No history. Okay, very good. I'm going to start with your skin. I'm going to look to see if there's any lesions or things that shouldn't be there, any discolorations, any bruising, anything like that. Any history of skin cancer, irregular moles?
No.
Okay. All right, I'm going to have you stand up for me so I can look at the back of your legs. Okay. All right, and the front, anything on your belly or your chest?
No.
All right. Okay, you can have a seat. If I can see your hand, I'm going to check for any pitting or discoloration in your nails. I'm going to look for any dark bands underneath your fingernails. I'm also checking the width of the tips of your fingers to make sure that they're at a 160-degree angle or less, to make sure you have no clubbing, which you do not. Next, I'm going to check your lymph nodes. This tells us about if there's any infections anywhere in the body, any possible metastases. I'm going to start with your occipital nodes back here, and then I'm going to go to your post-auricular, or behind your ear nodes. I'm going to check your pre-auricular, and then I'm going to go to your parotid lymph nodes, superficial cervical nodes, supraclavicular nodes, your submental and your sublingual nodes down here, which I do not feel anything. I'm going to go to the submandibular, both anterior and posterior, supraclavicular down here, and then also your axillary nodes. Okay, before I go any further, I'm going to wash my hands again. I'm going to be right back. Okay, now I'm going to check your head and neck. I'm going to check your head for symmetry, any bulging, any depressions in your head, which there is nothing. The shape of your face. Your eyes appear equal, no sagging. Can you smile for me? Very good, no drooping. There's no swelling in the sinuses or anywhere on the face or neck that I can see. Eyes are equal shape. Skull is good shape. Temporal arteries are not bulging. I'm going to check your temporal mandibular joint, if you can open for me, and close. Open again, and close. There's no popping or dislocation there. Check your neck muscles, if you can look up for me. Look down, look to your left, look to your right. Okay, look straight ahead. Push against my hand. Okay, the other side, push against my hand this way. All right, I'm going to check your trachea here. That appears to be midline. I'm going to check your jugular vein and your carotid artery here, and there's no distension there. Now I'm going to check your thyroid. I'm going to push to the left here to check the right side, or I'm sorry, the left side. Now I'm going to push to the right to check the right side. Okay. I'm going to have you put some water in your mouth, and when I tell you to swallow, I'd like you to swallow. So can check the movement of your thyroid. Okay, swallow. Okay. One more time for me, please. Okay, swallow again. Okay. Thyroid is normal, there's no enlargement there. I'm going to check your eyes now and your eye muscles. If you can follow my finger. Okay. Cover your right eye for me. Tell me how many fingers I'm holding up.
3, 2,
With looking at me. Okay, again.
3,
Okay,
1,
all right, now cover your, all right. How many am I holding up?
2,
How many?
3,
Okay, very good. All right, I'm gonna check your eyelids. Close your eyes for me. I'm gonna feel for any nodules. All right, open and look up for me. I'm gonna check the inside of your eyes here. Do you have any problems with getting things in your eyes? Do you feel like there's anything in there now?
no,
Okay, close your eyes all the way for me. Okay, they close completely. Very good. I'm going to check to make sure your blink reflex is there. You'll feel this in your eye for a very short time. Okay. Other eye, I'm going to use the other side. Okay. Very good. Now I'm going to check. There's going to be a bright light in your eye. Right now I am doing what's called corneal light test. I'm just checking for equal dilation of your eyes at the same time. I'm going to do the swing test. Okay. Look straight ahead. Okay. I'm going to look into your eye. Okay. And I do see the reflection, red reflection of the cornea in your eye. Have you ever had a broken nose or problems with your sinuses?
no,
Just look up your nose here. No issues there, no clogging, no problems with your sinuses. And finally, I'm going to check your mouth. Smile, teeth together. All right. I'm going to look at your tonsils. Open wide. Say ah. Okay, I'm going to check your gag reflex. Okay. No lesions or white spots on the inside of your mouth or palate. Tonsils do not appear swollen. No bleeding of the gums,
No.
problems, okay. And finally, I'm going to look at your ears. I'm going to check the outside of the ear. I'm going to check your helix, your antihelix, your tragus, your concha, your fossa, and I'm going to check the inside of your ear. And I'm looking at the membrane and the malleuses. I'm also looking at the annulus and light. No cerumen impacted. Same thing on the other side. And again, I see all those processes in there. And I'm going to check your hearing with the tuning fork. Tell me when you stop hearing. Should be about 15 to 20 seconds when you stop hearing.
okay,
Okay. Now tell me when you stop hearing.
okay,
Okay, I'm going to do the same thing on the other side. stop hearing.
Okay.
Okay. All right. Repeat the number. I'm going to have you put your left hand in your left ear and repeat the numbers that I say to you.
3, C, P,
Very good. Same thing on the other side.
4, R, 9.
Very good. Okay. That concludes our assessment. Do you have any questions for me?
No.
Okay, thank you very much and have a good day.